In this video, I'm going to talk about DCM, also known as cardiomyopathy, a terrible disease that is killing a lot of Dobermans. Dilated cardiomyopathy is a hereditary disease and has been present in the Doberman breed since the 1930s. It is characterized by heart dilation, which over time loses the strength needed to pump blood to the rest of the body. Every Doberman in the world has some kind of a cardiomyopathy in their bloodlines. Some are more severely affected than others, but none are genetically clean. It is not the only heart disease that is around, but it is the one that affects the most this breed. The walls of the heart, with the evolution of the disease, become thinner and less elastic, losing the ability to contract. As a result, oxygen in the blood does not reach the rest of the body in sufficient quantity, and the kidneys and lungs suffer the most. This dilation may also be associated with cardiac arrhythmias, which further complicate the function of this organ. In the beginning, we may not notice any symptoms or discomfort, but with its evolution through time, we begin to notice breathing difficulties, easy tiredness, blue tongue, sometimes fainting, and in some cases we can feel the irregular heartbeat just by touching the dog's chest. There are some tests that dogs can do to diagnose DCM: chest X-ray. Here you can see the increase in the heart size. Electrocardiogram, echocardiogram, Holter, an exam that lasts for 24 hours where the functioning of the heart is recorded by an electronic device. Some genetic tests can also be done, but these only help us to understand if the dog is a gene carrier, does not tell us if it is already affected by the disease. There is no definitive treatment for cardiomyopathy. We have maintenance treatments through drugs, but just that. All dogs affected with dilated cardiomyopathy should be treated by correcting the arrhythmias, increasing the heart muscle contraction strength, and preventing the fluid accumulation, such as blood and water inside the lungs, alleviating discomfort and improving the quality of life. Dilated cardiomyopathy is one of the most common causes of heart failure in large and giant breed dogs. Unfortunately, many breeders prefer to ignore the disease, and when a dog of their breeding dies of DCM, they opt to camouflage it, justifying it with another cause. When acquiring a puppy, demand the DCM screening of both parents, bearing in mind that the ideal is that these tests have not been carried out more than 1 year ago. Some studies suggest that eating grain-free kibble is associated with DCM, but nothing has yet been 100% proven. To support the dog's heart health, foods rich in taurine or some supplements can be provided. But for this to go well, ask a veterinarian specializing in nutrition for help. Write in the comments if you already knew about DCM, or if you had a Doberman affected by this disease. Thanks for watching, and see you on the next one.